Hello, everyone, and welcome. My name is Selena Belisle, and I am the founder and one of the board approved CE providers here at ceinstitute.com. We provide primarily massage and bodywork training to the Florida Board of Massage, Florida Board of Nursing, and Florida Board of Cosmetology licensees for CE credit. We're also board approved with NCB-TMB, the National Certification Board for Therapeutic Massage and Bodywork, and issue CE credit for them as well. Today, what I'm going to show you is the first 6.5 minutes of a training unit in our home study chair massage class that's available online here at the school. And it's going to show you the Boney landmarks that you need to avoid when practicing on-site or corporate chair massage. There are a lot of bones in the back that you do not want to apply pressure to because it would hurt and you could even hurt yourself. So we want to show these to you in better detail, and we have through this training video. Again, this is only 6.5 minutes. It's part of a larger class, and when I reference I'm going to show you this or that, that's if you are registered for the class, you'll be able to see more things. So you can register for that here at ceinstitute.com and just click on chair massage, and you will find our chair massage home study courses here. They're available to you 24 hours a day, 7 days a week after you register and purchase until your course access expires. We're also published in Chair Massage at Massage Magazine. It's massagemag.com. And our last article was March of 2022. And this is showing you how to set up an on-site corporate event for chair massage. And it was to combat the labor shortage. We also have other training videos here for free for you on YouTube in chair massage if you want to learn more. Just remember, we are a continuing education provider. That means we primarily teach to licensed healthcare providers and those who are licensed to touch and provide healthcare service. So you should have a license to practice massage and body work. You could be a nurse, physical therapist, occupational therapist, and other healthcare professions beyond massage. You should have had rudimentary training and precautions and contraindications to screen out for healthcare risks and more. And also, when it comes to chair massage, you should have formal chair massage training before trying to apply this in a real work situation because there are many more informational items that you do need to learn to properly apply chair massage compliance wise in a real work environment. So right now we're just showing, and this might be a refresher for our own students who have taken our training with us too. This is a portion of one of our training units to show you the bony landmarks of the backside of the body that you want to avoid during chair massage practice. Until we see you in another training, we hope you enjoy this short video. Now we're going to review the bony landmarks in chair massage because when you're applying your hands-on practice, we want to be massaging soft tissue, and having a client seated in a chair is a fairly different position than most of us are used to working when your client is lying prone, supinated, or side lying on a table. So let's review those bony landmarks and make sure we're not pushing into and hitting bone when our body mechanics change when we're working on somebody who's in seated position in a chair. So it's the back side of the body here that I'm going to focus on, and where I'm going to tell you where you should avoid pressing. Because sometimes with my massage techniques, I'm going to turn around and no longer be facing the client. I'll be looking away from the client because I'm going to put my elbow into the soft tissue of their backside and lean in with pressure. And I'm doing this to create proper body mechanics and make the work as easy as possible for me during chair massage. But you want to make sure wherever you're placing your elbow and pressing is not directly into bone because that would hurt. And possibly injure your client, never mind your own olecranon process of your elbow. So on the left-hand side of this screen, I have several little labels around the bony landmarks. First of all, at the top, you can see the spine of the scapula. Okay, that's a bony protuberance. You can usually feel through the skin. If you're working like the upper trapezius, avoid the spine of the scapula. Of course, the spinous processes running down the back side of the body from C1 to S1 and the sacrum, avoid the vertebral processes of the spine, okay? I think there's even case reports where some of these vertebral processes have been broken during massage. Too much pressure was applied. It never feels good to press and bone, and heaven forbid break bone. I mean, this is not what we're going for, folks. Now, the iliums, which are on the bottom portion of your left-hand image, just above the glutes, the iliums, the hip bones. I'm going to be doing some knee knocking. And if you look on the right-hand side, we have something, I usually call this the prenatal triangle, where you have your sacrum in the middle. So you're not going to, that's called the holy bone, right? As all the nerves pass through. You're not going to press super hard on the sacrum in the chair, even though it's great leverage. You could put your knee in there, your elbow there. Of course, you don't press on bones, so never do that. But avoid your sacrum, avoid the iliums that are jutting off from the left and right of the sacrum, and avoid the greater trochanters, okay? So when I'm doing the knee knocking with my knees into the low back and hips, you'll see I'm really focusing on applying my knee pressure into the glute maximus, the glute medius, okay? You're not going to see me hitting my knees into the greater trochanter, the sacrum, or the ilium. These are all bony landmarks you need to avoid during your chair massage. I have put a skeleton on a massage chair so you can see in real 3D terms what this looks like. Let me show you. So here we are, and we have a skeleton on a massage chair, so you can see the bony landmarks of where we're working. You can work up here near the occiput. Just be careful of the spinous process of the vertebral spine. You also want to be careful of the vertebral borders of the scapula. Anything between the vertebral process of the spine and the vertebral border of the scapula is fair game. So that trapezius, the rhomboids, just be careful that you're not pressing on the actual vertebral border itself. Now I'm showing where you can put your elbow, and you can be right next to that lamina groove, but make sure you're not actually on those spinous processes. You don't want to work on the sacrum and the ilium either. Pressing into the bone does not feel good. Showing on the other side, I'm going to just use my elbow running down the soft tissue between the vertebral process and the vertebral border of the scapula, between the spine and the scapula, all the way down. And we're not going to press directly on the sacrum or the iliums themselves. You can do twisting, alternate, or simultaneous. You can push soft tissue, the erector spinae, away from the spine. Just don't press directly on the spine. That, of course, would, or at the other bony landmarks, that, of course, would hurt. So I'll show you in a minute what this looks like on a live person beyond the scapula. And give me just one second. I want to show you what knee knocking might look like. And I'll show you on the, let me see here, on the skeleton first. So you have your iliums, you have your sacrum, and your greater trochanters. That's what we call the prenatal triangle. We're trying to enter our knee into the soft tissue of the glutes. So it's going to be your patella. You would use your right knee on the left-hand side of the client, and you hit with your knee, knock, 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 knock. Now I have my right hand on their shoulder to create contact. Now when I go to their left hip, I'm going to use my left hand on their right shoulder and then knock, 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 knock. And actually feels really good. And it's not harmful or hurtful to your body to be working down there in the hips to do that knee knocking. It's a really effective physical way to get some deep tissue, some deep ischemic